Ketamine is a dissociative anesthetic that was developed over 60 years ago. It's something that is a very unique anesthetic because it has a high safety profile. Ketamine ends up increasing one of the most excitatory neurotransmitters in our brain and ultimately leads to a release of something called BDNF, which is brain-derived neurotrophic factor. BDNF can cause neuroplasticity as well as neurogenesis. So it is the only psychiatric treatment that will help form and strengthen new connections, as well as help people see things in a different way, because it does alter the way that your brain is functioning while you're taking it.
So most of the evidence for ketamine being helpful in psychiatric symptoms is in depression. We know that it's very helpful for major depressive disorder or other depressive disorders. There is also evidence that can help with anxiety, and as people's depression gets better, their anxiety tends to improve. Starting about 20 years ago, people started doing very systematic research using ketamine as a treatment for depression and found it to be very effective even within one treatment. Some studies show about 80% of people get significantly better in terms of their depression with a single treatment. So since that time, it's become more widely available, and the evidence has grown in terms of how effective it is, and also how safe it is for people that have depression. It seems to also be helpful for anxiety.
Ketamine treatment is great for a variety of conditions, including treatment-resistant depression, OCD, anxiety disorders, bipolar disorder, as well as PTSD.
The other thing that we've seen success for ketamine in is people who have really entrenched, stuck ways of thinking and what I would call obsessive thinking. And the ketamine in some ways kind of helps them be more able to pull back and see a bigger picture and think in new ways.
Ketamine is a wonderful option that has very few, if any, longer-term side effects that will affect people after the infusions are completed. So for somebody that's tried multiple medications, somebody who doesn't like how they feel on medications, or somebody who is averse to taking any kind of pills on a regular basis, ketamine is a wonderful option.
The people running the program, including Dr. Lasser, Dr. Thompson, and myself, are all psychiatrists with years of experience working with mental health symptoms and treating those symptoms.
Almost every other ketamine clinic is currently being run by anesthesiologists or by emergency medicine physicians. Because of that, psychotherapy and other mental health treatments are rarely integrated into the treatment course. People tend to come in, get their infusion, and go home without any in-depth assessment or attention to other mental health factors that are affecting their current lives.
We know the different types of signs and symptoms of depression.
We also provide a very tailored treatment to each of our patients. So we take pride in the individualized care that we give.
We like to work very closely with people's referring physicians or any other doctors that you've seen over the course of time.
I think you can expect a comprehensive approach to treatment. I think you can expect to be cared for. I think you can expect compassionate treatment, and I think that you can expect very competent individuals to be handling your care.